Co-founder of the One Campaign and lead singer of the Irish multi-award-winning rock band U2 says that the approval of the 1% Consolidated Revenue Fund for primary health care is something that is good for the lives of the people. Paul Hussein, who is better known as Bono, made this declaration a few days ago during a short visit to Nigeria. TVC's Kemi Balogun had an exclusive interview with the country director of the One Campaign.
The Abuja Declaration of 2001, which led to the signing of the National Health Act in 2014, sets aside 1% of Consolidated Revenue Fund as part of the Basic Healthcare Provision Fund. 50% of it goes into the National Health Insurance Scheme. 45% goes into the National Primary Healthcare Development Agency, leaving about 5% as emergency fund utilized by Nigeria's Ministry of Health. The recent visit of the co-founder of One Campaign and former lead singer of the Irish multi-award-winning rock band U2, Paul Hussein, was here to commend the Nigerian government for the inclusion of the 1% Consolidated Revenue Fund into the 2018 appropriation budget. Bono had paid separate visits to Vice President Yemi Osinbajo and the Senate President Bukola Saraki, where he had given his thoughts on the issue of primary health care.
One of the commitments Bono shared with the Vice President during our visit and the Honorable Minister of Health is, can we get 1,000 wards across the country with PHCs that accept this basic healthcare package? Can that be, after 12 months, can that be something we can hold the government to? And we had a good level of agreement for that. In fact, the Honorable Minister said we could do more. So let's start with 1,000 wards.
The country director of One Campaign says all these gateways are key to having a stronger healthcare system in Nigeria.
One of the reasons that One Campaign is focusing and making sure that Basic Healthcare Provision Fund works and actually delivers service is that it speaks to a lot of our gaps. So NHIS, it speaks to that. MPCDA, it speaks to that. NHIS is abundantly clear that that needs to work. And guess what? Basic healthcare provision is a forcing function. Now we're all paying attention to this thing that needs to work, and NHIS is a key conduit to making it work.
This is the first step to getting closer to revamping Nigeria's healthcare system, especially for the rural areas.
If we're able to restructure and ensure that we revitalize primary healthcare centers in Nigeria, it'll be a game changer for healthcare. Medical tourism happens because it's broken on the primary level, secondary level, and tertiary level. So when you have a headache, instead of going to your PHC, you go to Luth, you go to Juth, you go to the tertiary. So the pressure on the tertiary becomes so much because the rest are not working properly.
The One Campaign is confident this amount will enable the federal government provide and fund quality and basic healthcare services for the benefit of all Nigerians when the 2018 appropriation bill becomes law. Kemi Balogun, TVC News, Abuja.